Welcome to This Explainer. Today, we're going to break down the definitive, chronological process of correctly deploying an automated external defibrillator, or as we all know it, an AED. Look, if you've ever felt that sudden surge of panic, just wondering what you would actually do if someone collapsed right next to you, you are exactly in the right place. We're going to take that completely normal fear and transform it into focused, life-saving action by showing you the correct way to use an AED.
So, we'll be walking through the entire rescue journey today. Our roadmap includes the critical window, scene preparation, step-by-step deployment, age-specific pad placement, the CPR cycle, and finally, maintenance and beyond. Let's get right into it.
Section 1. The critical survival window. We're going to start with exactly why time is your absolute biggest enemy in a sudden cardiac emergency. 10%. Think about that number for a second. For every single minute that passes without an AED shock, a person's chance of survival drops by approximately 10%. Literally, if 10 minutes go by, that window of survival essentially closes tight. This makes immediate action absolutely critical. Waiting around to find a device while doing nothing? Never the right call. But getting an AED deployed within those first few minutes can actually double or even triple the chance of survival. Now, here's a fact that should instantly take a huge weight off your shoulders. The AED diagnoses the heart rhythm, not you. It's incredibly empowering to remember that the device itself is doing the heavy lifting by reading the heart's electrical activity. Not every cardiac arrest is shockable, right? But the machine knows the difference. It takes all the guesswork out of the equation and makes the diagnostic call for you. You really don't need to be a cardiologist. You just need to be the person brave enough to open the box. Moving to Section 2, pre-shock scene preparation. Because before you even crack open that AED, you've got to quickly make sure the environment and the patient are actually safe for an electrical shock. In the real world, emergencies are incredibly messy. You're probably wondering right now, what about standing water? Or if the patient is pregnant or has a medical implant? These are the real-world variables that always make bystanders hesitate. So let's clear those up. Here are the definitive rules for scene safety. First off, you got to move victims away from standing water or combustible gases. Now, if it's a drowning victim, wet clothes are perfectly fine. You just have to wipe their bare chest dry so the pads can actually stick. If you spot a nicotine or medication patch exactly where a pad needs to go, peel it off and wipe the skin. What about underwire bras? If it's resting directly in the electrical pathway, just disconnect or shift it out of the way. And for pregnant patients, well, the protocol here is to treat a pregnant patient just as aggressively as anyone else, because the absolute best way to ensure the survival of the baby is to save the mother. All right, Section 3, step-by-step AED deployment. With the scene totally secure, it's time to act with confidence and actually deploy the AED, all while a second rescuer keeps chest compressions going for as long as humanly possible. Getting this right follows a strict 4-step sequence. Step 1, and please don't skip this, power on the device first. The second you open the lid or hit that power button, the voice prompts take over and literally walk you through the rest. Step 2, expose the chest. You might need to use the trauma shears to cut away bulky clothing or a razor to shave some heavy chest hair so the pads make direct skin contact. Step 3, apply the pads firmly. And step 4, stand absolutely clear while it analyzes the rhythm. Seriously, do not touch the patient during this analysis phase or you're going to interfere with the machine's reading. Let's head Section 4, pad placement by age, because size really does matter here. Pad placement is immensely important for both rhythm analysis and shock delivery, and it varies significantly depending on how old and how big the patient is. Okay, listen up, because here is a crucial warning. Back in 2025, the Resuscitation Council UK and the European Resuscitation Council updated their placement guidelines based on some brand new evidence. But because manufacturers hold on to large quantities of older stock, the diagrams printed directly on your AED pads right now might actually be up to 5 years out of date. Crazy, right? So you need to know the modern placements in your head rather than blindly following an older picture on the package. So what do those modern 2025 guidelines actually say? Well, for adults, the right pad stays right where you'd expect, on the upper right chest. But the left pad now goes fully under the armpit to improve the electrical pathway straight through the heart. Now, for infants and small children under 25 kilograms, which is roughly under 8 years old, you're going to use an anterior-posterior setup. That's just a fancy way of saying one pad goes in the center of their back, and the front pad goes on their chest, but slightly offset to the child's left side. You just got to ensure the pads never overlap or touch each other on those tiny little bodies. And when you're treating a child, the energy delivered also needs to change. children require an attenuated or lower energy shock. The recommended starting energy dose there is exactly 2 joules per kilogram of body weight. You achieve this by either using specific pediatric pads or, on a lot of modern devices, simply turning a pediatric key or flipping a switch that automatically drops the energy output down to that safe level.
But what happens if you only have adult pads available and you are suddenly faced with a pediatric emergency? Do you just do nothing? No. Expert guidelines are incredibly firm on this. You should absolutely use the standard adult pads on a child or infant. Yes, it delivers a stronger shock than is ideal, but hesitation can be fatal. Any shock is vastly better than no shock when you're dealing with a life-threatening heart rhythm.
Which brings us to Section 5, the AED and CPR cycle. It's a continuous loop. You see, an AED does not replace CPR. Rather, the two interventions work perfectly together in a continuous life-saving loop that maintains blood pressure and oxygenation. Coordination here is just everything. Let's say at 0 seconds the AED delivers a shock, or maybe devises no shock. Within 1 single second of that prompt, you must immediately resume 30 chest compressions, followed right away by 2 rescue breaths. You do not stop and wait to see if they wake up. You just keep doing this continuously for 2 solid minutes until the AED prompts you to pause again so it can reanalyze the rhythm. Smooth coordination between you and whoever is helping should keep your total pause time strictly under 10 seconds per cycle. And speaking of those rescue breaths, there is a super vital distinction you've got to remember. While hands-only CPR is highly effective for adults who suddenly collapse from a primary heart issue, children and infants actually require rescue breaths. Why is that? Well, it's because pediatric cardiac arrests are most often caused by respiratory failures. Think things like choking or drowning. Providing oxygen through rescue breaths directly addresses the underlying cause of their cardiovascular collapse.
Finally, Section 6, Maintenance and Advanced Support. We're nearing the end of the rescue journey here. Just having an EED on the wall is really only half the battle. It's got to be properly maintained and understood within the broader context of emergency medical care.
So there are some pretty strict maintenance rules you really need to know. First off, AED pads are strictly single use. Once you stick them on, they cannot be reused. Full stop. Furthermore, they expire every 2 to 4 years. And this isn't just some arbitrary date the manufacturer slapped on the box. The crucial adhesive gel actually dries out over time. If that gel is dry, the pad cannot securely adhere to the skin, which basically prevents the device from reading the heart rhythm, or worse, delivering a shock without causing serious burns.
And to wrap this up, it's really important to understand where you fit into the whole chain of survival. Using an AED is a foundational part of basic life support, or BLS. It essentially acts as a bridge, maintaining the patient's oxygenation and trying to restore rhythm until paramedics or code teams rush in. Once they do, they take over with Advanced Cardiovascular Life Support, or ACLS, where they introduce advanced airways, intubation, and emergency pharmacology. But listen, they rely entirely on your BLS foundation to keep that patient viable until they get there. You are literally the critical first link. We know for a fact that an AED can double or triple survival rates when deployed correctly in those first few critical minutes. So I'm going to leave you with the single most critical question of this entire explainer. If a coworker, a family member, or even a total stranger collapse near you right this second, do you know exactly where to find your nearest device? Take a mental note next time you walk into a building, because being prepared means knowing your resources way before you ever actually need them. Thank you so much for joining me for this explainer, and hey, stay safe out there.